All right, let's go. Number 10. Chamomile in Neanderthal teeth. In 2012, a team led by archaeologist Karen Hardy at the Autonomous University of Barcelona published an analysis of hardened plaque scraped from the teeth of Neanderthals recovered at El Cedrón cave in northern Spain. The remains were roughly 50,000 years old. The plaque, calcified into a rock-hard shell over the enamel while its owners were still alive, had preserved something no one expected to survive that long. Trapped in the mineral matrix were microscopic chemical traces of plants. Not the bones of prey, not the starches of gathered roots. Chamomile. Dental calculus is one of the strangest archives in all of archaeology. Every time a mouth chews, microscopic fragments of whatever passes through it become embedded in the film of bacteria coating the teeth. That film mineralizes. It hardens into a substance that resists decay far better than bone, sealing its contents like amber. Plant compounds that would have rotted from the soil within a season can survive for tens of thousands of years inside a single molar. The result is that a Neanderthal, who died before the last glacial maximum, still carries, in his mouth, a partial record of what he put into it. And what he put into it was a small daisy-like flower with white petals and a golden center, one that releases a sweet, apple-like aroma when crushed between the fingers. The chemistry is the part that refuses to be dismissed. Chamomile contains apigenin and bisabolol, compounds that are anti-inflammatory, mildly sedative, and soothing to the digestive tract. These are not folkloric properties. They are measurable pharmacological effects, isolated in laboratories, characterized down to the molecular structure, still present in products sold in pharmacies today. A flower head no larger than a fingernail delivers a genuine, if gentle, therapeutic dose. But here's where the standard picture of Stone Age life begins to fall apart. Chamomile offers no meaningful caloric value. It is not filling, it is not fatty, it is not sugar-rich. It provides essentially nothing to an organism whose entire existence was organized around the acquisition of energy in a cold and unforgiving landscape. A Neanderthal foraging in Ice Age Iberia operated under a brutal metabolic economy, where every hour spent gathering something had to return more than it cost. Chamomile fails that test completely. Gathering it was, in pure survival terms, a waste of time. Unless the point was not hunger. That is the entire argument, and it is a difficult one to escape. Selection implies purpose. Something in that cave chose a plant that could not feed him, carried it, and consumed it. The most economical explanation for a non-nutritive plant deliberately entering a human mouth is that the person doing the chewing expected an effect other than fullness. Relief, calm, the settling of a churning gut, the reduction of a swelling that hurt. What makes this particular finding so unsettling is its ordinariness. Chamomile is not exotic. It is the plant in the tea bag at the back of the cupboard, the mildest remedy in the entire pharmacy, the thing given to children and to people who cannot sleep. And it appears, consistently, across an almost incomprehensible span of time. It surfaces in prehistoric sites long after the Neanderthals were gone. It appears in the medical traditions of Egypt, of Greece, of Rome, of medieval Europe, of the modern world. The same flower, used for the same complaints, in an unbroken chain, stretching from a cave in Ice Age Spain to a supermarket shelf. The implications extend further than a single plant. If the record of prehistoric medicine is written into calcified plaque, then almost all of it is unreadable, because almost all of it was never preserved. We have the teeth of a handful of individuals from a handful of sites across hundreds of thousands of years of human and Neanderthal existence. Every mouth that decayed, every skull that crumbled, every healer who worked and died and left no jawbone behind, took their entire pharmacopoeia with them. What we recovered is not the library. It is one page, torn from the middle, and even that single page contains a drug that still works. The flowers still grow across Europe. They still smell of apples when crushed. They are still being picked by people who have no idea how old the habit is. Number 9. Yarrow, the wound herb. The same calcified plaque that preserved the chamomile at El Cedrón preserved something else. Yarrow, a second non-food plant, locked into the teeth of Neanderthals who died in a limestone cave in the mountains of northern Spain roughly 50,000 years ago. One anomalous plant in the dental record can be explained away. accidental ingestion. Contamination during handling. The residue of a plant used for bedding or fuel rather than medicine. Two anomalous plants, both bitter, both pharmacologically active, both found in the mouths of the same population, is no longer an anomaly. It is a pattern. Yarrow grows as a low, feathery plant, with leaves so finely divided they resemble fern fronds, topped by flat clusters of tiny flowers ranging from white to pale pink. Crush the foliage between your fingers, and the smell that rises is sharp, herbal, faintly medicinal, the kind of scent that registers as a warning rather than an invitation. That warning is accurate. Yarrow is intensely bitter. Bitterness in the plant kingdom is a chemical alarm system, an evolutionary signal developed specifically to make animals stop chewing and spit. It works. It has worked on mammals for tens of millions of years, which is precisely why finding it in a Neanderthal's teeth is so difficult to dismiss. Consider what a foraging population is optimizing for: calories, fat, protein, starch, sugar. Every hour spent gathering is an hour not spent hunting, and every plant that goes into the mouth is evaluated by a palate calibrated across millions of years of evolution to reward energy and punish toxicity. Yarrow offers almost nothing on that ledger. It is not a starch source. It is not an oil source. It provides negligible caloric return for the effort of collecting it, and its taste actively repels the animal eating it. There is no scenario in which yarrow becomes a staple food. There is no scenario in which a hungry forager, given a choice, reaches for it. Something else was driving the decision. But here is where the argument moves from inference to chemistry. Yarrow is not merely bitter. It is functional. The plant contains compounds that promote blood clotting, accelerating the coagulation cascade at the site of a wound, and additional compounds that reduce inflammation in the surrounding tissue. Applied to a cut, it slows bleeding. Taken internally, it moderates the swelling and fever response. This is not folk reputation attached to an inert weed. This is measurable pharmacology, and it points in one direction. Yarrow is a wound plant. The name itself carries the memory. Yarrow's botanical designation is Achilleia, a reference to Achilles, who, according to Greek tradition, used the plant to treat the wounds of his soldiers on the battlefield at Troy. The Greeks were writing that down roughly 3,000 years ago. The Neanderthals at Ephedra had the compound in their mouths some 47,000 years before anyone wrote anything at all. The name is not evidence of the practice. The name is evidence of how long the practice outlasted the people who invented it, surviving across species, across the extinction of an entire human lineage, into the mythology of a civilization that had no idea it was inheriting anything. What makes the yarrow at Ephedra particularly unsettling is the picture it forces. These were not people idly sampling the landscape. Someone in that cave was injured. Someone was bleeding or swollen or feverish. And someone else knew which of the hundreds of plants growing on those Asturian slopes would help, walked out and found it, and brought it back specifically because it was useful and not because it was food. That requires observation across generations. It requires the recognition that a cut treated with the feathery plant closes faster than a cut left alone, a correlation buried under enormous noise, visible only to a group paying sustained attention over decades. It requires, in other words, medicine. The El Cedrón cave still sits in the karst country of northern Spain, its bone assemblage curated and catalogued, the plaque on those teeth holding chemical traces of a decision made by a mind we were taught could not make it. The patient's name is unrecoverable, so is the healer's. What survives is the bitterness, still detectable, still pointing at intent. Number 8. Ephedra in a Neanderthal grave. In 1960, archaeologist Ralph Selecki, excavating a cave in the Zagros Mountains of northern Iraq, uncovered the skeleton of a Neanderthal man laid in a shallow depression in the cave floor. The site was Shanidar. The burial has been dated to approximately 60,000 years ago. Selecki sent soil samples from around the body to the French palynologist Arlette Leroy-Gourhan, who analyzed the microscopic pollen preserved in the sediment. What she found in 1968 was not the scattered background pollen that drifts into every cave on Earth. It was clustered, concentrated, grouped in dense clumps around and beneath the body, in quantities and arrangements that do not occur when wind carries grains through a cave mouth. The burial became known as the flower burial, But the plants identified in that pollen were not decorative, they were pharmacological. Among the species recovered was Ephedra, wiry, jointed, broom-like green stems with almost no leaves, growing in the dry uplands surrounding the cave. Chewed, it tastes faintly resinous and slightly bitter. It has almost no nutritional value. It would not have filled a stomach or flavored a meal. What it contains is ephedrine, one of the most powerful stimulants available in the natural world. Ephedrine constricts blood vessels, dilates the bronchial passages of the lungs, clears nasal congestion, elevates heart rate, and drives a sharp increase in alertness and physical energy. It opens airways that respiratory illness has closed. It pushes an exhausted body past the point where exhaustion should have stopped it. The scale of this claim deserves precision. Ephedrine is not a folk remedy with a mild effect and a gentle margin. It is a controlled and regulated compound in modern medicine, restricted in most developed nations, monitored at the point of sale, and administered clinically under supervision because of its effect on cardiac function. The compound that Leroy Gourhand's pollen grains point toward is one that a pharmacist in the 21st century cannot hand across a counter without documentation. It was in the soil of a grave, dug by a species that vanished 40,000 years ago. But here's where the standard picture of Neanderthal life falls apart. The pollen was not found in a hearth or a refuse layer or a place where food was processed. It was found with the dead. The clustering suggests deliberate placement. Plants brought into the cave and arranged around a body at the moment of burial. And the assemblage was not random. Ephedra appeared alongside other species with documented medicinal properties, a group of plants that share almost nothing in common except their effects on the human body. A person selecting plants at random from the Zagros hillsides would not produce that list. Someone selecting for pharmacological activity would. The implications extend further than a single grave. If the plants were placed deliberately, then whoever placed them possessed a working knowledge of what those plants did. Knowledge of that kind is not acquired in a lifetime. It is accumulated across generations, tested against sickness and injury, remembered and transmitted. It requires language sufficient to describe a stem, a season, a dose. It requires a concept of illness as something that can be acted upon. And it requires the belief that the dead should be sent into whatever came next carrying medicine. The interpretation is contested. In 1999, researcher Jeffrey Summer proposed that burrowing rodents native to the region, which are known to hoard plant material underground, could have introduced the pollen clusters after burial. The debate has run through journals for decades and has not been settled, but the alternative explanation carries its own weight, because it does not dissolve the burial itself, only the flowers. The body was still placed. The site was still chosen. Something at Shanidar was doing more than discarding its dead. What remains, regardless of which explanation prevails, is the pollen. Microscopic grains of a stimulant plant, preserved in cave sediment for 600 centuries, recovered from the soil around a man whose species we long insisted was incapable of thought beyond survival. He was buried in a mountain cave in northern Iraq, before modern humans reached Europe, before language as we recognize it can be demonstrated, before anything we would call culture is supposed to have existed, and someone, or something, left medicine with him. Number 7. Honey, the antimicrobial dressing. On a limestone wall in eastern Spain, inside a shelter known as the Cuevas de la Araña, someone painted a scene roughly 8,000 years ago that has no equivalent anywhere else in prehistoric European art. The figure is suspended in midair, gripping a rope or a woven ladder of vines, one arm extended into a crevice in the rock face. Around the body, rendered in the same red ochre, are dozens of small dashes, bees. Below the figure, nothing but the drop. The painting depicts a wild honey harvest. It is one of the earliest images humans ever made of themselves acquiring a substance, and what it records is not hunting, not gathering, not the pursuit of calories in any efficient sense. It records a person climbing a cliff into a swarm. Consider the economics of that act. Honey is not a staple. It cannot be stored in quantity by a mobile population. It cannot feed a group through a winter, and the effort required to obtain it is disproportionate to the energy it returns. The climb was vertical and unroped by any standard we would recognize. The hive would have been defended by thousands of stinging insects. A fall meant death. A sufficient number of stings meant death. and the reward was a few kilograms of thick, golden, slow-flowing liquid that smells of flowers and clings to everything it touches. People did this repeatedly. They did it often enough, and it mattered enough, that they painted it on a wall. But here's where the standard explanation of honey as a rare prehistoric luxury begins to fall apart. Honey is not merely sweet. It is one of the most effective naturally occurring antibacterial substances on the planet, and it achieves this through three independent mechanisms operating simultaneously. Its water content is extraordinarily low, typically under 20%, which makes it hygroscopic. Placed against living tissue, it pulls moisture out of everything around it, including out of bacterial cells, desiccating them until they cannot function. Its pH sits between roughly 3 and 4, acidic enough to suppress the growth of most wound pathogens, and enzymes deposited by the bees themselves release hydrogen peroxide slowly and continuously as the honey is diluted by fluid from the wound. A layer of honey over torn flesh does not simply cover it. It draws the wound dry, acidifies it, and floods it with a low, sustained dose of a disinfectant that would not be identified chemically for another 80 centuries. The truly disturbing aspect is that none of this has been superseded. Medical-grade honey dressings are stocked in hospital pharmacies in the 21st century. They are applied to burns, to diabetic foot ulcers, to surgical wounds that have refused to close, to infections that have shrugged off antibiotics. Sterilized by gamma irradiation, packaged in sealed foil, dispensed by wound care specialists with clinical training. The active substance in that package is chemically indistinguishable from what the figure on the wall at Cuevas de la Araña was climbing toward. We did not improve on it. We packaged it. What makes this particularly unsettling is the inference the painting forces. The risk-to-reward calculation only balances if the climbers knew what the substance did. A pleasant taste does not justify a cliff face and 1,000 stings. But a reliable treatment for wounds in a world without any other reliable treatment for wounds does. In a population where a deep cut from a flint edge or a gash from a boar's tusk carried a meaningful chance of killing you over the following 10 days, a substance that prevented that infection would not be a delicacy. It would be the single most valuable pharmaceutical available, worth the climb, worth the swarm, worth the fall. The painters left no explanation. There is no text, no accompanying image of a wound being treated, nothing that closes the argument. There is only the figure, the rope, the bees, and 8,000 years of silence. And the honey itself is still there, in a foil packet on a shelf in a hospital supply cupboard, doing exactly what it did on the cliff face, unchanged and unimproved, the oldest medicine we still trust. Number 6. Willow bark and salicin. In a cave in the mountains of northern Spain, a place called El Cedrón, researchers recovered the remains of a group of Neanderthals and did something that would have been impossible a generation earlier. They scraped the hardened plaque from their teeth. Dental calculus is one of the strangest gifts the archaeological record offers. It forms in life, mineralizes on the tooth, and traps microscopic fragments of everything that passed through the mouth. Starch grains, plant fibers, chemical signatures of things chewed, swallowed, or held between the molars. It is a sealed archive of a single individual's diet, locked in place at the moment of death and preserved for tens of thousands of years. One of those individuals had been in pain. The jaw showed the unmistakable damage of a dental abscess, an infection of the tooth root that produces some of the most severe pain the human body is capable of generating. Anyone who has experienced one understands that it does not fade with distraction. It throbs with the pulse. It radiates into the jaw, the ear, the skull. And embedded in the calculus of that same suffering individual were chemical traces of poplar. Poplar is a close relative of willow. Both trees carry salicin in their bark. Salicin is not a folk remedy in the vague sense. It is a compound. The human body absorbs it and converts it into salicylic acid. And salicylic acid is the direct chemical ancestor of modern aspirin. Not a distant cousin. Not a plant that happens to help a little. The active mechanism is the same lineage of molecule that sits in medicine cabinets on every continent, in a drug that remains among the most widely used pharmaceuticals in the world. It reduces fever. It reduces inflammation. It reduces pain. A single compound addressing 3 distinct symptoms at once, which is precisely why it survived the transition from bark to tablet and never left. And it tastes appalling. This is the detail that makes the El Cedrón evidence difficult to dismiss. Chewed bark is fibrous and stringy, unpleasant to work between the teeth, and intensely bitter. It is astringent in the way that unripe fruit is astringent, drying the mouth, pulling the tissue tight, leaving a residue that lingers long after the material is spat out. It offers almost nothing nutritionally. Nobody chews poplar bark because they are hungry. Bitterness in the natural world is a warning signal, an evolutionary flag that a plant is defending itself with toxins, and every foraging instinct a hominin possesses is calibrated to avoid it. Something overrode that instinct in a Neanderthal with an infected tooth. But here's where the standard picture of prehistoric medicine falls apart. Finding a medicinal plant at a site tells us the plant was present. It does not tell us the plant was understood. Pollen blows into caves, seeds arrive on the wind, on fur, in the guts of animals. Presence is ambiguous. This is not presence. This is a specific compound recovered from the mouth of a specific individual suffering from a specific condition that the compound treats. The bitter, useless, painful to chew bark and the infected jaw are found in the same skull. That is not gathering. That is targeting. The implications are staggering. It means that a species we spent a century characterizing as cognitively inferior had established a link between a tree, a sensation, and a result, and had retained that link well enough to act on it under duress. It means someone identified the correct tree, stripped the correct tissue, and endured a taste designed by evolution to repel them, because they had learned that the misery of the bark was smaller than the misery of the tooth. Somewhere behind that act sits an unrecorded chain of observation, stretching back generations. A body of knowledge transmitted without writing, without measurement, without any conception of what a molecule is. Willows still grow along riverbanks across Europe, and their bark still carries salicin, unchanged. The tree does not know it is a pharmacy. The chemistry that dulled the agony of an infected Neanderthal jaw is the same chemistry pressed into tablets and swallowed by hundreds of millions of people every single day, and the only difference between then and now is that we finally learned the name of the thing they had already found. Number 5. The poppy and morphine. In the mountains above the Mediterranean coast of Granada, in southern Spain, there is a cave the locals call the Cueva de los Murciélagos, the Bat Cave. Inside, preserved by the dry air of the interior chambers, Neolithic burials were found alongside woven baskets of esparto grass, and inside those baskets, among the grave goods placed with the dead, were poppy capsules, seed pods, dried and split, deliberately gathered and deliberately kept. They date back more than 6,000 years. The plant they came from is Papaver somniferum, the opium poppy. Above ground, it is almost absurdly delicate, papery flowers in red or purple that shed their petals within days, mounted on thin, gray-green stems. What matters is what comes after the flower falls. The remaining seed pod swells into a bulbous green-to-tan capsule, and when the surface of that capsule is scored with a blade, it weeps a milky white sap. That sap is latex. That latex contains morphine and codeine. These are not folk remedies. Morphine and codeine remain, to this day, among the most powerful natural painkillers known to medicine. Morphine is still the reference standard against which other analgesics are measured. It is stocked in every emergency room, every surgical suite, every hospice on Earth. The entire class of opioid drugs that dominates modern pain management descends directly from the sap of that pod. Whatever else our ancestors found in the landscape, they found this. And the poppy remains do not appear only in Spain. Opium poppy seeds and capsules turn up across Neolithic Europe, in lakeside settlements, in waterlogged deposits, in domestic refuse, and in graves, distributed across a range that has nothing to do with the plant's natural habitat. The wild ancestor of the opium poppy is a Western Mediterranean species. The archaeological remains stretch far beyond it. But here is where the standard picture of Stone Age plant use falls apart entirely. Willow bark can be stripped from a tree that happens to be growing beside a river. Yarrow can be picked while walking past it. Those are acts of gathering, and gathering requires only observation and memory. The poppy is different. To find poppy capsules in quantity, hundreds of kilometers from where the plant grows wild, in the graves of a farming community, requires that someone planted it. Someone cleared ground for it. Someone saved seed from one harvest to sow the next, and did so consistently enough that the plant traveled with human populations across a continent. That is cultivation. And cultivation of a non-food crop implies something considerably more disturbing than herbal knowledge. It implies scheduling. It implies a group of people allocating land and labor to a plant that produces no meaningful calories, in a subsistence economy where every square meter of cleared soil represented survival. They gave up food to grow a drug. They did it season after season. They did it well enough that the practice outlived them by millennia. The implications extend further. A crop that moves across a continent moves through hands. It moves along the same routes as flint, as shell, as obsidian, as the other things Neolithic Europe traded. A cultivated poppy is not simply a medicine. It is a commodity, a thing with value, a thing worth carrying and worth exchanging, and its distribution across Neolithic Europe suggests a supply chain for pharmacology operating 5,000 years before the first written prescription. What makes this particularly unsettling is what it says about knowledge transfer. Nobody discovers the opium poppy by accident. The seeds are inert. The leaves are unremarkable. The value is locked inside an unripe capsule and released only by cutting the surface at the right stage of maturity and collecting what bleeds out. That is a procedure. It has steps, and the steps must be taught, and someone must have taught them to someone else, and that chain of instruction held across thousands of kilometers and hundreds of generations without a single written word to carry it. We do not know what they called it. We do not know whether it was given to the dying, to the injured, to the initiated, or to all three. What survives is a basket of dried pods in a cave in southern Spain, placed carefully among the dead by people who understood exactly what they were burying, and who left no explanation at all. Number 4. Ötzi's Fungus Pharmacy. In September 1991, two German hikers crossing the Ötztal Alps on the border between Austria and Italy found a body emerging from melting ice at 3,200 meters. They assumed it was a mountaineer who had died in a recent accident. It was a man who had died 5,300 years ago. Ötzi, as he came to be called, is the most thoroughly examined human being in the archaeological record. His stomach contents, his tattoos, his copper axe, the arrowhead lodged in his left shoulder, the last 3 meals he ate. Every element of his final days has been reconstructed with a precision that no other prehistoric individual can offer. But the most significant thing he carried was not a weapon. Threaded onto strips of leather and carried on his person were 2 pieces of birch polypore fungus. Woody, hoof-shaped brackets, roughly the size of a human palm, with a smooth, pale brown upper surface and a spongy, cork-like off-white underside. They were not food. Birch polypore is tough, unpleasant, and offers almost nothing nutritionally. They were not tinder either. Ötzi carried a separate fungus for fire-making, kept apart from these. The polypore had been cut, prepared, and mounted for portability. Deliberately. He was carrying it the way a person carries something they expect to need. Birch polypore contains agaric acid and polyporenic acids. These are not folklore compounds. They are pharmacologically active substances with demonstrated antibacterial and antiparasitic properties, capable of disrupting the biology of intestinal worms and inhibiting bacterial growth. In laboratory conditions, extracts of this fungus perform exactly as a targeted antimicrobial agent should perform. Then the analysis of his intestines came back. Ötzi's gut contained the eggs of Trichuris trichura, whipworm, a parasitic nematode that burrows into the wall of the large intestine and produces chronic abdominal pain, diarrhea, anemia, and progressive weakness. He was infected. He was carrying, on leather strips, a fungus with antiparasitic activity against precisely the class of organism living inside him. But here is where the discovery becomes genuinely disturbing in what it implies. This is not a general-purpose remedy applied to a general-purpose complaint. This is a specific compound matched to a specific infection in a specific individual whose body we can still examine. Ötzi did not know what a nematode was. He had no concept of a parasite, no microscope, no theory of contagion, no germ theory of any kind. Germ theory would not exist for another 5,200 years. And yet he was carrying, on his body, in the mountains, in the last hours of his life, the correct medicine. The knowledge did not come from theory. It came from observation, accumulated across generations, tested on bodies, refined by outcome. Somebody in Otzi's world had noticed that people who ate this bitter, woody fungus stopped passing worms. That observation was remembered. It was transmitted. It was formalized into practice specific enough that a man crossing a high alpine pass thought to bring it with him. What makes this particularly unsettling is the scale of what it represents. Otzi is one man. He survives because a glacier happened to close over him and hold him for 53 centuries in a state of preservation that borders on the miraculous. He was not exceptional. He was not a healer or a shaman, as far as anyone can determine. He was an ordinary Copper Age man carrying ordinary Copper Age equipment, and his ordinary equipment included a functional antiparasitic pharmacy. Which means the knowledge was common. Which means there were thousands of people walking those valleys carrying the same fungus for the same reason, and every single one of them decomposed. The pharmacology of an entire era rotted into soil. We recovered one man by accident, and he happened to be carrying proof. The fungus is still there. Both pieces sit in climate-controlled storage at the South Tyrol Museum of Archaeology in Bolzano, a few rooms from the body they were meant to treat. The leather strips are intact. The brackets have not decayed. They remain, in every measurable sense, medicine, prepared, portioned, and ready for a patient who has been dead for 5,300 years and never got the chance to take his next dose. Number 3. Beeswax fillings and flint drills. In 2006, a team of researchers led by paleoanthropologist Roberto Macchiarelli published findings in Nature describing 11 human molars recovered from a Neolithic burial ground at Mehrgarh, in what is now Balochistan, Pakistan. The teeth belonged to 9 individuals, adults, buried roughly 9,000 years ago in a farming settlement on the edge of the Indus Plain. Each of the 11 molars had a hole in it. The holes were not decay. They were not cracks or fractures, or the ordinary erosion of a hard life-eating stone-ground grain. They were cylindrical, near perfectly circular, between 1 and 3 millimeters wide, and up to 3.5 millimeters deep, driven straight down through the enamel, into the dentin below. Someone had drilled them. The tool has been identified. Flint drill heads recovered from the same site, small tapered points mounted on what was almost certainly a bow drill, the same technology used at Mehrgarh to bore holes through beads of turquoise and lapis. The bead makers of this settlement were among the most skilled craftsmen of the Neolithic world. Somebody realized that a technique capable of perforating a stone the size of a fingernail could be turned on a living human jaw. The precision is the part that resists explanation. Experimental replication has demonstrated that a flint-tipped bow drill can cut through molar enamel in under a minute. Enamel is the hardest substance the human body produces. To bore through it cleanly requires the drill to be held steady against a curved, wet, moving surface inside a mouth that belongs to a conscious person. And the person was conscious. No anesthetic existed. Nothing in the Neolithic pharmacopoeia could render a patient insensible and still leave them alive and cooperative on the other side. Whoever sat for this procedure sat awake, jaw braced open, while a stone point spun against the roof of a tooth. But here's where the evidence becomes genuinely disturbing. The drilled surfaces show wear, polish, rounding, the microscopic smoothing that only occurs when a tooth is used for years of chewing after the fact. These were not post-mortem rituals performed on the dead. These were treatments performed on the living, and the living got up afterward and went back to eating. 4 of the 11 teeth show evidence of decay associated with the drill site, which suggests the procedure was therapeutic, an attempt to excavate rot from a tooth before it killed the person attached to it. The practice persisted at Mehrgarh for approximately 1,500 years before disappearing from the record entirely. Then there is Slovenia. In 2012, researchers led by Federico Bernardini at the Abdus Salam International Center for Theoretical Physics in Trieste published an analysis of a human jawbone recovered near the village of Lonche, radiocarbon dated to roughly 6,500 years ago. The left canine was cracked, a vertical fissure running down the crown and exposing the pulp cavity beneath. Someone had filled it. Sealed into the crack was a pale yellow plug of beeswax, applied while the individual was still alive, its edges conforming precisely to the fracture. It is the oldest known dental restoration on Earth. Consider what that requires. An understanding that an exposed nerve causes pain. An understanding that sealing the exposure relieves it. A material chosen for its plasticity, its stability at body temperature, its resistance to bacterial colonization. Beeswax is still used in dental practice today for exactly these reasons. What makes prehistoric dentistry particularly unsettling is not the skill, it is the timeline. Drilling and filling, the two foundational procedures of restorative dentistry, were being performed thousands of years before the invention of the wheel, before writing, before metal, before the first city rose anywhere on the planet. The people of Mehrgar had no word for bacteria, no theory of infection, no concept of the pulp chamber as an anatomical structure. They had a bow drill, a piece of flint, and the observation that removing the rot sometimes saved the patient. The teeth are still there, 11 molars in a museum collection, each one bored through with a hole so clean it looks machined, each one polished afterward by years of grinding grain between jaws, that survived a procedure no one has ever explained how a person endured. Number 2. Antibiotic beer in Nubian bone. In 1980, anthropologist George Armalagos, then studying skeletal collections recovered from ancient Nubia along the Sudanese Nile, examined thin sections of human bone under ultraviolet light and saw something that had no business being there. The bone fluoresced. A yellow-green glow ran through the internal structure in bands, following the growth layers of the skeleton the way rings follow the growth of a tree. That particular signature has one well-documented cause in modern medicine: tetracycline. Tetracycline is an antibiotic, not a plant compound with mild antibacterial properties, not a folk remedy with a plausible mechanism, a true broad-spectrum antibiotic of the kind dispensed by prescription. It was not isolated and named by modern science until 1948. The skeletons Armalagos was examining had been buried roughly 2,000 years earlier. The initial reaction within the field was skepticism, and reasonably so. Contamination from soil bacteria was the obvious explanation. Bone left in the ground for millennia is not a sealed container. But tetracycline has a specific and unusual property that makes it uniquely traceable across deep time. It binds to calcium. When it enters the bloodstream, it is drawn into bone and locked into the mineral matrix during deposition, which is precisely why the fluorescent bands sit inside the growth layers rather than on the surface. The drug had not seeped in from outside. It had been laid down from within, while these people were alive, layer by layer, over years. Later work, including chemical analysis in which the bone was dissolved and the remaining compounds identified by mass spectrometry, confirmed the finding. The tetracycline was real, it was distributed through the skeletal structure, and it was present in a striking proportion of the population examined. The source was almost certainly the beer. Nubian brewing did not produce anything a modern drinker would recognize. This was not a clear amber liquid in a glass. It was thick, cloudy, and porridge-like, fermented from stored grain, sour and yeasty, with a gritty texture closer to a thin gruel than a beverage. Grain stored in warm mud bins in the Nile Valley becomes colonized by Streptomyces, a soil bacterium that naturally produces tetracycline as a chemical weapon against its microbial competitors. Ferment that contaminated grain, and the antibiotic passes into the brew. Drink the brew, and the antibiotic passes into the bone. But here's where the accident explanation begins to fall apart. Contamination is random. It should produce erratic results, a handful of individuals with faint traces, most with nothing. That is not what the bone shows. The concentrations are consistent, they appear across the population, and they appear in individuals of every age, including the very young. The pattern is not that of an occasional lucky exposure. It is the pattern of a substance consumed regularly, in reliable doses, across the entire span of a lifetime. Which raises a question with no comfortable answer. Did they know? They possessed no concept of bacteria. They had no microscope, no germ theory, no framework in which an invisible organism causes disease, and a second invisible organism destroys it. What they had was observation across generations. Grain stored a certain way, in a certain kind of vessel, for a certain length of time, produced a brew that kept people from falling ill. Those who drank it recovered from infections that killed others. Whether the practice was named, ritualized, or simply repeated because it worked, the result was the same. A population medicating itself, continuously, with a compound that would not be isolated in a laboratory for another 2,000 years. The rate of infectious bone lesions in these skeletal populations is notably low. Whatever they were doing, it was working. The truly unsettling aspect is how completely this inverts the assumed direction of medical progress. We tend to treat antibiotics as the sharp line separating the modern world from everything before it, the moment humanity finally stopped losing children to scratched knees. That line was crossed once in a laboratory in the 20th century, and it was crossed before, quietly, in mud brick storerooms along the Nile, by people who left no explanation of what they had done. The bones are still in collections. Placed under ultraviolet light, they still glow. Number 1. Stone Age skull surgery. Somewhere in Neolithic Europe, roughly 7,000 years ago, a person lay still while another person cut a hole through the top of their head. No anesthesia, no antiseptic, no understanding of infection, blood pressure, or the tissue waiting a few millimeters beneath the bone. The instrument was stone. The technique involved scraping, grooving, or boring through the cranial vault until a disc of skull could be lifted free and the membrane covering the brain lay exposed to open air. The patient survived. We know this because bone does something obliging. It heals. Around the margins of countless trepan skulls recovered from prehistoric burials, the cut edges are not sharp. They are rounded, smoothed, remodeled. The unmistakable signature of living tissue closing over an injury across weeks, months, and years. These were not post-mortem rituals performed on the dead. These were operations performed on the conscious, and the people who endured them walked away and kept living long enough for their skeletons to record the fact. The openings themselves are unsettling in their tidiness. Neatly rounded or oval, roughly the diameter of a coin, placed with evident intent rather than desperation. Not the ragged fracture of a club strike, not the splintered collapse of a fall. A deliberate, controlled aperture cut into the hardest bone in the human body with flint. And it was not rare, and it was not local. Trepan skulls have been recovered across Europe, across the Americas, and across North Africa. Separate continents, separate populations, separate languages, tools, cosmologies, and burial customs. Populations divided by oceans that none of them could cross arrived independently at the same conclusion, that under certain circumstances, the correct intervention was to open the skull, and independently developed the manual technique to do it without killing the patient. But here's where the standard picture of the primitive past collapses entirely. In some Neolithic populations, survival rates for trepanation appear to have exceeded the survival rates for comparable cranial surgery performed in hospitals in the 1800s. 19th century surgeons operated with steel instruments, with formal anatomical training, with published medical literature behind them, and lost their patients to infection at rates that a Stone Age practitioner, working with a flint blade, apparently beat. The variable that killed Victorian surgical patients was not the incision. It was the ward, the unwashed hands, the reused instrument, the transfer of contamination from one open body to the next. Whatever the Neolithic operator was doing in the open air, with a single tool and a single patient, it was cleaner. The truly disturbing aspect is the evidence for repetition. Some individuals carry multiple separate openings in a single skull, each at a different stage of healing, which means the procedure was performed, the patient recovered, the condition returned or persisted, and the patient submitted to it again. They knew what was coming. They had felt the scraping the first time. They understood exactly what the stone would do to the top of their head, and they lay down for it a second time. That is not superstition. That is a patient making a calculated decision about a treatment they believed worked, based on prior experience of it working. We do not know what they were treating: skull fracture, chronic headache, seizure, whatever they understood pressure and pain to be. The intent is buried with them. What survives is the competence. Someone in the Neolithic knew how deep to cut, knew when to stop, knew the difference between the outer table of bone and the membrane beneath it, and knew that crossing that boundary would end the procedure and the person at once. That knowledge could only have come from accumulated observation, from failures that taught, from a body of practice passed between hands across generations. The skulls sit in museum drawers now, on 3 continents, in cases labeled with catalog numbers. Pale, quiet objects, with a single smooth-edged window cut into them. Held up to a light, the bone around the opening glows slightly thinner, where it closed itself. A hole made by a stranger, with a piece of stone, sealed shut by a body that refused to die, in a world that had not yet invented writing, metal, or the wheel. Line up the compounds recovered from these 10 entries, and the list reads like a modern pharmacy inventory. Salicin, the molecule behind aspirin. Morphine and codeine, still the standard against which every other painkiller is measured. Ephedra, a bronchodilator that opens airways and remains regulated in most of the world for exactly that reason. Apigenin and bisabolol, anti-inflammatories with mild sedative effect. Agaric acid, with genuine antibacterial and antiparasitic activity. Tetracycline, an antibiotic that mainstream medicine did not formally identify until 1948, found embedded in the bones of people who died roughly 2,000 years earlier. Not folk remedies. Not superstition dressed as treatment. Pharmacologically active compounds, correctly selected, correctly targeted, and in many cases still sitting on hospital shelves today under different names. The people who assembled this knowledge had no writing, no chemistry, no microscope, no isolation of active ingredients, no concept of bacteria, no germ theory of any kind. They did not know why willow bark reduced a fever. They did not know that the fungus threaded onto a leather strip contained anything at all. They only knew that it worked, that it had worked before, and that someone before them had known it too. That is the mechanism. Not genius, not inheritance from some vanished advanced culture. Observation, repeated across thousands of generations, with every result that failed being quietly discarded along with the person it failed. An experiment run continuously for tens of thousands of years, with a sample size of every human being who ever got sick, and a peer review process consisting entirely of whether the patient survived to tell anyone. What makes this record particularly unsettling is not that our ancestors were clever, it is how thoroughly the word we assign them collapses. Primitive. The label survives in textbooks, in museum captions, in the shorthand we use for anyone who lived before agriculture. It does not survive contact with the evidence. A Neanderthal at El Cedrón chewing a bitter, nutritionally useless plant while nursing a dental abscess was not behaving primitively. A Slovenian jaw, sealed with beeswax, 6,500 years ago, is not primitive. A skull with a coin-sized opening, whose edges have smoothed over with years of bone regrowth, is not primitive. It is medicine, practiced by people whose names, methods, and reasoning are gone forever. And the results still hold. Put birch polypore under a microscope and the antibacterial activity appears. Assay honey and the hydrogen peroxide release is measurable, which is why medical-grade honey dressings are stocked in wound care units in the 21st century. The conclusions those healers reached without instruments have been re-derived by people with instruments, and the conclusions match. We did not discover these things. We rediscovered them, cataloged them, gave them Latin names, and then forgot that anyone had gotten there first. The archive is not written down. It exists in dental calculus, in pollen trapped in cave sediment, in the trace metals locked into Nubian bone, in the healed rim of a hole cut through a living skull with a piece of flint. Every one of those objects is a research note left by a scientist who had no word for science. They are still being read, they are still yielding results, and the people who compiled them across 100,000 years of trial and error will never know that we finally checked their work and found it correct. If you want to see more videos like this, click the video on screen now and make sure to subscribe.